My name is Dr. Sampa Mukuka. I work at the Kitwe District Health Office. This is an office that oversees the small clinics around Kitwe District. I received training under Merck Foundation in 2019, and I completed the training. And this training was assisted reproductive technologies. This training was done in 2019 in India. Advanced Assisted Reproductive Technologies is a course that is offered over 3 months, and it involves training in ovulation induction for those patients who are infertile, and it also offers training in vitro fertilization. So the course involves a 3 weeks intensive theory training, which looks at the concepts of fertility in detail. And then you are given the rest of the time to do the practicals, where you encounter real patients who are undergoing fertility treatment. It offers an opportunity to understand the depth of the course from the theoretical point of view and the practical point of view, and you actually see the real patients and be able to gain the expertise that is needed to treat subfertile couples. Upon my completion of the course, I've been working for Kitwe District Health Office, which gives me a platform to see patients who are coming from the community. These are not patients who are referred from any institution. They actually just come from the community to seek medical advice, including subfertility. So I've had an opportunity to manage a number of patients with a lot of successes, where patients have actually conceived and managed to carry a pregnancy to term. Regarding the training, I've also been involved in lecturing medical students who are training to become medical doctors, and I've been able to offer the same training to the medical students, so that as they become full-time doctors, they have the knowledge of infertility. Going forward, I intend to become a full-time lecturer with any of the universities to offer this same training or program or fertility subtopic to the medical students, so that we can share the knowledge with them. I also personally intend to open my own specialized clinic, which will be offering fertility services to the public, as this service is not readily available to the general public. Previously, I talked about working at a district level, where I'm able to see patients who come from the community, and I'm able to evaluate them and look at the particular fertility problem that they have. This has given me an opportunity to manage these patients and prevent them from being referred to very far institutions where they could get fertility care. So I have actually managed to manage the patients at a local level, and this has prevented and reduced the amount of money that a particular patient would spend in accessing fertility care. As a district, we do look at the high-risk patients who come to the facility, and some of those who come with subfertility. So some of the challenges that we face is that we are not able to provide in vitro fertilization services. These services will require referral regardless of the specialist being there. So this poses a challenge to certain patients who cannot afford to seek these services at a higher level where they need to have in vitro fertilization services. Assisted reproductive technologies comes with the need to expand knowledge in making diagnosis. And one of the intentions that I have personally is to train in gynecologic laparoscopy. This will enhance the ability for me to diagnose problems regarding subfertility. As a specialist, as a gynecologist, I am mandated to continue training others in my field of practice. So this means that the training of other doctors as well as other upcoming doctors is part of what I'm supposed to do, and this is a continuous process that we continue giving to our junior doctors who are coming up to become senior doctors. I am very likely to refer a friend or a colleague to train in fertility, as there are very few fertility specialists, and the need for fertility care in my community is very, very high, and we will need more clinicians to be trained in assisted reproductive technologies so that we increase access to this service. I would like to thank Merck Foundation for giving me an opportunity to train in fertility. This has given me a very good platform to assist members of the community in their fertility problems. Thank you, Merck Foundation.